Hello, and thank you for joining the St. Edward's School Open Enrollment presentation. Open enrollment begins on February 18th and will run through March 1st, 2019. During this period, you're making benefit elections that will be in place from April 1st, 2019 through March 31st, 2020. We'd like to welcome our 27 member institutions to ICUBA's 17th annual ICUBA Open Enrollment. We hope you find this information valuable. ICUBA tackles the biggest challenges when it comes to healthcare. We want to make sure that our members have the best access to health and well-being benefits so you can seek care at the right place at the right time with the right provider. We also encourage active engagement in our benefits plans to improve your health and well-being. We offer lots of programs like Rally to help you stay engaged. We provide the highest quality care with a safe, effective process, and we make sure that you have the lowest cost possible for services through several of our brand partners. This is to help with your outcomes. We want our members to have the best health and well-being outcomes as far as your health care is concerned.
Did you know that ICUBA medical plans are self-funded? As a self-funded medical plan, ICUBA pays all claims processed by our medical, pharmacy, and behavioral health partners from premiums collected and reserves built up over the years. ICUBA keeps all premium dollars saved for the exclusive benefit of our members. We spend premium dollars only on benefits for our members, and our plan is pretty unique. It's designed by educators for educators. ICUBA invests in a long-term culture of well-being so you can be the best version of yourself. And so how do we work to keep plan costs low, as Rachel mentioned earlier? We've done this by establishing some programs and efficiencies to help mitigate claims costs. So we have for you $0 co-payments when you visit a Blue Distinction Total Care provider. There's $5 teledoc visits, low prescription drug co-payment structures. We always encourage you to get your biometric screening so you know your numbers. We provide case management and care consultants. And we're also innovative and willing to invest in resources like ICUBA Cares, Teledoc, Rally, Resources for Living, and new this year, there's Surgery Plus. So we have a call to action. What can you do? You can take advantage of your free preventative care screening so that you know your baseline. Register for Teledoc ahead of a sickness so that you're prepared. Call ICUBA Cares to see if they can help you lower your prescription drug costs. Take advantage of those free 6 EAP sessions. Visit your dermatologist for a preventative skin cancer screening. Use the Blue Cross and Blue Shield pricing tool so that you can shop for the best price, for example, for your advanced imaging. And then join the Rally City Challenges and sync your devices for a chance to win $50.
So from the annual survey that we conducted a few months ago, we found the main concern from our members was cost. So we put together this comparison for you to show the average annual cost of employee-only coverage. This is the average across all of our member institutions, but what this illustration demonstrates is that with adjustment factors for demographics, our population is slightly older than the average demographic population out there. It also takes into consideration location. You may not know that Florida is one of the most expensive states to provide health care in, and the plan value that you're receiving from ICUBA is actually a much richer benefit than that's out there in the marketplace. So even with all of these factors coming into play, this still shows or illustrates that we are below the education industry in average annual cost and far below everybody else. Another way to break this down, how ICUBA stacks up against the others, what this shows is on the left, all other PPO plans that are out there, and then on the right versus the education industry. So we're basing it versus the average, which is the blue dot in the middle of both of these lines. So what this is showing you is ICUBA's costs are 17% below the broad database average out there, meaning all other PPO plans, and we're 22% below the education industry average. So you really are getting a really great bang for your buck when it comes to benefits. We understand that they're expensive, but in the comparison across the industries, you're actually getting a very good benefit. So what are some of the things that we're going to talk about? We're going to review enrollment and eligibility, some perks that are offered through ICUBA, and your 2019 benefit plans.
So first up, under enrollment and eligibility, enrolling in your benefits at ICUBAbenefits.org. During open enrollment, this is your chance to update your benefits for the 19-20 plan year. The elections you make during open enrollment will remain in effect through next plan year. You may make some election changes mid-year, only within 30 days of a qualified life event. And so for open enrollment, when you go to ICUBAbenefits.org, you'll see a button that says Start Your Enrollment, and you'll click there and make your enrollment choices for next plan year. There's also available again this year, Ask Emma. She is available in English and Spanish. Emma is a decision support tool. She can help you make smart, cost-effective benefit decisions to fit your individual needs. Emma will ask you a few personalized questions, and with those answers, she will recommend what she feels is the best choice for you. Emma also has some FAQs available, so if you're wondering what deductible means or maybe what out-of-pocket maximum means, those FAQs will be available for you. She's available in the top left-hand corner of your enrollment instance.
So who's eligible for ICUBA's benefits? This is just a summary of who's eligible to be enrolled in our benefits. Your legally recognized spouse, a natural child, legally adopted child, stepchild, child that's covered by a qualified medical child support order, a child for which you have legal guardianship over who also resides with you, and foster children. ICUBA's plan is very unique in which we cover dependents that are 26 until the end of the year in which they turn 26. So if you have a dependent that turned 26 in January, February, or March, they are still eligible to be enrolled as of April 1st. But just a reminder, we'll send you an email at the end of the year letting you know that their coverage will end on December 31st, 2019. We know that everybody reads every single word of the fine print before you click I agree at the very end. But just in case you missed this blue paragraph, you are certifying that all the dependents covered by your benefit elections are in fact yours.
Again, this year, ICUBA will be holding an open enrollment sweepstakes. And just by entering your personal email address and phone number, you'll be entered into the sweepstakes for a chance to win a $50 Amazon gift incentive. So as you're going through the enrollment process, you will click I agree to let us know that your information is correct and up to date. And then you'll continue through and finalize your enrollment, and you're automatically entered in to win. We also want to highlight the single sign-on that's available to you. It's available on your ICUBAbenefits.org homepage under the My Carrier Account section. Through these links, you'll be able to access our brand partner websites where you can print out a temporary card, order a replacement card, check your claim status, check your benefits. You can look for an in-network provider and much more. When you access these links for the first time, you may be asked to register so that you can create a username and password. And then from there on, once you click those links, you'll be automatically logged into your individual accounts on our brand partner sites.
So medical plan perks offered through your school's membership with ICUBA. New this year, we have an exciting new benefit with Surgery Plus. We're also going to be reviewing some current benefits that you have available to you. Just as a reminder, Teledoc, ICUBA Cares Pharmacist Advocate Program, and Blue Rewards powered by Rally. So we're really excited to announce our new supplemental benefit that's through Surgery Plus. This benefit will be effective on April 1st and is meant as a supplement to your medical election. So once you elect the ICUBA medical plan, you are automatically receiving the Surgery Plus benefit effective April 1st and forward. Surgery Plus brings to us their surgeons of excellence. These network participants are licensed, board certified, have completed a fellowship, and have proven lower complication rates. The physician contracting process with Surgery Plus is very strict. They have a lot of controls in place. So they do have to go through a very strict and rigorous process to be a part of the Surgeons of Excellence, but you have the satisfaction of knowing that you are being treated by one of the best. Surgery Plus covers hundreds of medically necessary non-emergent planned surgeries. We have a few of the locations of the body listed here, but for instance, if you need a knee replacement, that is medically necessary, it is non-emergent, you're able to plan that surgery out, that would be a perfect reason to call Surgery Plus. Effective April 1st, you have access to the Surgery Plus Care Advocate team. This is a full concierge service, which creates the best member experience for you. If you choose to use the Surgery Plus benefit and contact these concierge service, and you do line up a surgery through Surgery Plus, you can have your coinsurance and deductible waived for your consultation and surgical procedure. I will caution you that if you do need a knee replacement, for instance, that will also come with physical therapy. The physical therapy will be run through your Blue Cross Blue Shield insurance. However, the surgical procedure can ultimately eliminate the out-of-pocket cost by using the Surgery Plus network. The concierge team really handles everything from start to finish for you. They'll locate the 3 best surgeons that fit your needs, and they'll provide you with the 3 surgeons and a short bio of the surgeons to equip you with the information that you need to make a decision. They will schedule all appointments and manage logistics with you, and they can help coordinate items like record transfers from your current physician to your new surgeon of excellence. The average call length for the first call is about 4 minutes to get you established in their system, and the average time to procedure is approximately 35 days. So these are surgeries that can be planned out, and you can make arrangements for them ahead of time. And again, this benefit is available on April 1st.
Another perk we wanted to review again is Teladoc. We still have those $5 copays for Teladoc. You can access it via single sign-on through the My Health Toolkit website. You can do your telemedicine or video consultations with a doctor 24 hours a day, 7 days a week. You do have to register and establish an account, and we do suggest that you do that ahead of time so that when you're sick, you don't have to bother with registration and answering questions. The company key or company ID is IQUBA, and so that Teladoc benefit is available now at the number on the screen or through the My Health Toolkit app. And so here we wanted to highlight some of the top diagnoses that you would want to call Teladoc for. Sinus problems, ear infection, pink eye, allergies, upper respiratory infections. If you need a controlled substance prescription, those are not available through Teladoc, so you would want to contact your primary care physician. And we do just want to highlight that this benefit is not meant to supplement your ongoing relationship with your primary care doctor. It's meant as an alternative to maybe urgent care or maybe convenient care. And so when you're on Teladoc, please make sure that you're sharing all of your records with your primary care physician. Also available again this year is the IQUBA Cares Pharmacist Advocate Program. They are all real pharmacists. They will advocate on your behalf and help you if you have any issues with accessing prescriptions. If maybe you have a drug that it's a non-preferred brand, so it's in a higher tier, they can help you maybe find a preferred drug. If you just need maybe a prescription checkup, you want to just check into the prescriptions that you're taking, make sure that there are not any type of adverse reactions that you'll have with any of your other drugs. They can help you with prior authorization, step therapy, and quantity limits. They're available for us Monday through Friday from 9 a.m. to 5 p.m. The number is here on the screen, and it's all co-located on the back of your OptumRx prescription insurance card.
The 2019-2020 Blue Rewards powered by Rally plan is remaining virtually the same, but we've made a few coin enhancements for you. Covered employees and covered spouses under the medical plan still have access to up to $250 in those gift card incentives. We still have the Rally survey as our gatekeeper. So the first thing you'll want to do after April 1st is log into the Rally site and complete that Rally survey. We've upped the coins for that this year to 400. We've also added coin incentives for Teladoc registration. So get in there and register for Teladoc. If you're already registered for Teladoc, you will receive an email that your coins have been awarded at the start of the plan year. We also have coins for tobacco attestation, and we've added clinical rewards this year as well. The clinical rewards is targeting chronic conditions. So if you have one of the conditions listed on the screen here, your home screen might look a little bit different. What Rally is doing is they're just providing you with additional education materials to help you get better control or better understanding of your chronic condition. So they will provide you with reading materials. They might encourage you to contact a health coach, but they will set quarterly goals for you. If the goals are achieved, you can earn up to 500 coins per quarter or up to 2,000 Rally coins for the year. The private sweepstakes were very popular last year. Everyone likes being a winner. So the sweepstakes are still tied to the survey, missions, and challenges. The most popular and most fruitful winnings do come with those city challenges. You have the ability to win a $50 Amazon incentive every time a milestone is reached. So make sure that you are checking into those city challenges and syncing your device with those challenges frequently, because every time a milestone is reached, you can be entered to win one of those $50 Amazon incentives. And those are given away every 14 days.
And so up next, we want to review your core benefits. IQVIA has strategically paired with the best in class to offer you your medical, prescription, and behavioral health benefits through Blue Cross and Blue Shield, OptumRx, and Aetna. And so here we just wanted to make sure that you get the care you need at the right place. So we have in green, yellow, and red. In green, this is your first stop for your everyday health services, your primary care office visits, where you get your annual checkups, preventative care visits, help with common illnesses, and those to help you manage your diseases and your ongoing medical conditions. If you use a Blue Distinct Total Care provider, it's a $0 copay. With your other plans, it's a 20% coinsurance on preferred, and then that $35 copay for the 4,000, 8,000 plan. In the middle here in yellow, you want to be a little bit more cautious for your Teladoc, your convenient care, which is your CVS Minute clinics or Walgreens healthcare clinics, or your urgent care. You'll consult those if you have maybe sinus problems, pink eye, bronchitis, nasal congestion, or allergies. There's a $5 Teladoc copay, $10 convenient care, and then $30 urgent care under preferred, and $70 under the 4,000, 8,000 plan. And then lastly, in red there, you want to be a little bit more cautious when choosing the emergency room. This is for your life-threatening health problems, chest pains, major traumas, heart attacks. That's a $300 copay under the preferred, $5,000 under the $500, under the $4,000, $8,000 plan. And of course, that copay is waived if you're admitted. And we do just want to mention that you should be mindful of those freestanding pop-up ER clinics that are everywhere. They look like urgent care, but they do come with that $3,000 ER, $300 or $500 ER copays. We also have health management and care consultants available to you. So you may get a call from time to time. They're calling you because they care. They are trained health advisors and registered nurses. They're calling so that they can provide you with tools, education, and advocacy to help you manage those chronic health conditions. They can help you with setting goals, better understanding your doctor's treatment plans, and support your referrals, transition of care, gaps in care. So you may get a call from Blue Cross and Blue Shield, Optum, IQVIA Cares, or Aetna. If you get a call, please answer at least once, and they can help you manage your conditions. And then by talking with these care consultants and health management, they can help reduce overall cost for the plan, which will reduce premiums for everyone.
In that same member survey, we got some feedback that Blue Cross Blue Shield's customer service team wasn't up to par. So we shared that information with them, and they've implemented what they call their Care Connected Enhanced Customer Service Team. What this team brings to us is their specialized customer service representatives. They're specifically trained in IQVIA's benefits. They also installed some technology behind the scenes. So if you're calling in during normal business hours, your ID number will be routed to the same health advocate that helped you previously. So if you're calling back to check on something or just calling with another question, this saves you from having to re-explain your situation each and every time. It's the same phone number that's on the back of your Blue Cross Blue Shield ID card, the same customer service number with just this enhanced service. We're still offering the Blue Distinction Total Care free primary care physician visits. So this is just a reminder that if you're in the market for a new primary care provider, to get on My Health Toolkit, and on the left-hand side of the screen, you can filter. Make sure that you select the Blue Distinction Total Care, and then you can search for family practice, internal medicine, or pediatric providers. And all medically necessary services performed in their offices are always free. So just look for this Blue Distinction Total Care logo in that, that profile. The preferred PPO medical plan is changing slightly this year. The deductible and out-of-pocket maximums are increasing slightly. For those increases, the individual will be increasing by $500 and the family will be increasing by $1,000 for both the deductible and the out-of-pocket maximum. Everything else shown in gray will stay the same. So you still have those copays for the teledoc, convenient care, and urgent care, and then most of the rest of the plan is a co-insurance structure. But we just wanted to highlight those increased deductibles at the top. The $4,000, $8,000 deductible PPO medical plan is also still an offering for you. We want to caution you to be sure that you know the differences in these plan offerings. This plan provides freedom for families with children, and we encourage you to only enroll in this plan if you really have one of those more healthy families. The deductible and the out-of-pocket are significantly higher than the preferred PPO plan. The co-insurance and co-pays are higher. So if you're a frequent user or you have a catastrophic event, even though the premium cost is lower, you could end up spending more if you're enrolled in this plan. This is just a summary of that $4,000, $8,000 deductible plan. This will be a silver equivalent if you were to go to the exchange, but at the top in gold, it highlights those higher deductibles, co-insurance, and out-of-pocket. And then in the lighter gold in the middle, that shows the higher co-pays and co-insurance and ER visits. So those are the differences in the two plans. At the bottom, you can see the things that are the same between the preferred PPO and the $4,000, $8,000 plan. So you still get a $5 teledoc benefit with either plan, but I will caution you to the items highlighted in gold at the top.
And so knowledge is power. So with these changes, we just wanted you to be aware of some of the services that do not apply to this deductible that will be increasing. There's advanced imaging, your annual checkups, your chiropractic care, speech therapy, occupational therapy, of course, your lab work, which is medically necessary through Quest. These listed here on the screen and many more are not going to be subject to that deductible. So we still have some very rich and great benefit offerings through IQVIA. And then on the flip side of that, we also wanted you to be aware of those major services that would be subject to your deductible, any hospital expenses, your hearing aids, skilled nursing rehab, x-rays, home health care. All of these major services will be subject to the deductible. So you can go to the My Health Toolkit. They have a pricing tool on there. Make sure you go out there and shop around for different providers or facilities so that you can make the best choice for you and your family.
IQPA's prescription drug plan is not changing this year. What I'd like to highlight on this page is a 90-day supply will save you money. We're still sticking with that same tiered structure. So if you need a preferred generic, for instance, it will cost you $5 for a 30-day supply at a retail location. However, if you need a 90-day supply, who doesn't like saving money? I encourage you, if it's available to you, to opt for that 90-day supply, because then you get 3 months for the cost of 2. I'll also highlight the prescription drug freebies. If you're a diabetic, we offer prescribed diabetic supplies for free to you, as well as aspirin for adults, generic folic acid, and generic prenatal vitamins for pregnancy, and prescribed generic statins. If you're eligible for those statins, you can also get those for free as well. OptumRx got pretty higher, they got higher marks on that annual survey, but I do want to highlight their new member portal. They did some upgrades to their digital portal last year, so if you've not been through the single sign-on section at icubabenefits.org, we encourage you to go out there and check it out. You can set up your mail order, manage your medications, find retail pharmacies by zip code, but there's a lot of cool stuff out there that you are able to do now.
Next is the Aetna Behavioral Health and Substance Abuse Program. We just wanted to review that this is available for you for professional counseling. If you need to get a refill or prescribed psychiatric medication, it's available. They also have some applied behavioral analysis therapy benefits for those who are covered under the plan who may have autism. And then there's some intensive services for those who require hospitalization, detoxification, or inpatient residential treatment. Also available through Aetna is their condition management program called ABLE2. This program is at no cost to IQBA members who are enrolled in the medical plan. It's an 8-week program where you get to meet with a therapist or a coach via the telephone or web-based video conferencing. It's 16 sessions, again, over 8 weeks, and they can help you just address some of the emotional challenges that may come along with some of these health and life conditions that sit to the left of your screen. I will say that I personally took advantage of the ABLE2 program for chronic pain. I cannot say enough great things about this program. So if you have one of these health or life conditions, please pick up the phone and give Aetna a call for their ABLE2 program. That again is at zero cost to those enrolled in the medical plan.
Aetna also covers your full emotional well-being. So with the same phone number that's on the back of your Aetna card, you can press option 1 for the EAP program or option 2 for behavioral health. They've also braced you with several mobile apps so you can try to track your emotional well-being so you can be the best version of yourself. The EAP program through Resources for Living is available to everyone at your school. Not only do you don't have to be on the medical plan, you don't have to have any of the benefits that are offered, you just simply have to be an employee. So this service is free and confidential, and you can call about emotional support, life, legal, or financial services, and you gain access to 6 sessions per issue per year. So with this benefit, if your students are driving you crazy and you want to take advantage of 6 sessions, perfect. And then if you want to gain some legal expert opinions or some financial opinions with the tax season coming up, that is considered a different issue and will allow you 6 additional sessions, 6 sessions per issue per year. So this benefit is available to everyone at your institution. So we really encourage you to take advantage of this free benefit. The EAP is also going digital. With TalkSpace, you can now text a therapist. This provides an online therapy platform for everybody. I know that in today's day and age, everyone's so busy, you don't have time to take, an hour out of your day to actually speak with somebody or make an appointment to see a therapist in person. So with this benefit, average of 1 week of Talkspace messaging is equal to 1 EAP session. This allows you to send multimedia text messages, audio, picture, videos through your web browser or the mobile app. I will caution you that this is not the immediate interventions or immediate feedback that you would get from texting a friend. This is your therapist, has 1 working day to respond to you, but goes back to the 1 week of Talkspace messaging is equal to 1 EAP session. You do have to call Resources for Living for authorization to use this benefit. You must be 18 years or older to use this benefit, but once you call and get the authorization, they can walk you through registering for Talkspace through a web browser or a mobile app, whatever fits your needs better, and it's just another way for you to seek the access to care that you need.
Next, we want to review the HRA, which is the Health Reimbursement Account. The HRA is funded by your employer at the end of each month. It's automatically given to you with your enrollment in an IQBA medical plan. There's also vesting tied to this account. So once you're enrolled in an HRA for 36 continuous months, you become vested in those funds and they're yours to keep. The funds can be used for eligible healthcare expenses for that are incurred by you or any of your dependents that are covered under your medical plan. The funds roll over at the end of the year as long as you are on the IQBA medical plan or vested, and the HRA earns interest quarterly. Next up is the Healthcare Flexible Spending Account, or the FSA. Unlike the HRA, the FSA is funded by you, the employee, with pre-tax contributions. The maximum that you are allowed to elect this plan year is $2,000. You do not need to be enrolled in the IQBA medical plan in order to elect an FSA. The amount that you elect is available to you the first day of the plan year, April 1st. Now the funds, they are subject to the use it or lose it rule, so you do want to plan wisely. Anything that you don't use by the end of the plan year, at the end of that grace period, you lose. The funds in the FSA can be used for eligible healthcare expenses for yourself and any of your tax dependents. The FSA is, like the HRA, it is tied to the IQBA Benefits MasterCard. One thing to note about the FSA, you do have to make an active election each year. So you do have to log into that open enrollment experience and make an active election for the FSA. The Dependent Care Flexible Spending Account, or the DCA, is next. This is also an employee-funded account. You're funded in line with payroll, so as you get your paychecks, deposits will be made into the DCA. Pre-tax contributions. There is a maximum calendar year limit of $2,000 per household. I do want to make note that during the enrollment instance, the system may allow you to elect more than that $2,000, but you are limited to $2,000. There will be a little text box alert that will pop up in your enrollment that will state that as well. So just be mindful that your maximum amount you can elect for your dependent care is $2,000. Funds in the DCA can be used for children under the age of 13 or a physically or mentally challenged adult who is unable to work and care for themselves. The funds can be used to pay for adult daycare, child care, preschool, summer camp, your before and after school programs as well. The DCA is subject to the use it or lose it rule, so you'll want to plan wisely. DCA is pretty easy to plan for because you usually know what the child care expenses will be. And this, as well as the FSA, the DCA requires an active enrollment, so you do have to log in during this open enrollment period and make that DCA election.
Voluntary benefits that are offered by St. Edward's School are Symetra benefits, which is life and disability. St. Edward's also offers benefits through AFLAC and Guardian, and you'll need to visit HR for more information on those. The income protection benefits included through Symetra are basic life and basic accidental death and dismemberment. These are provided to you at no cost by St. Edward's School. Voluntary life, spouse life, and child life are employee paid. These are elected by you, and long-term disability is also available in the event that you're out for a long period of time. During this open enrollment, you may have the opportunity to increase your life insurance coverages. If you do increase it and you receive this pop-up notice, this is triggering you or showing you that you will need to complete that evidence of insurability process through Symetra's secure portal. So at the end of your enrollment, if you receive this note, the single sign-on page will be triggered at the very end of your enrollment process after you submit your elections. It will pop up in a new window. This is the only time that you'll have to complete this this evidence of insurability process with Symetra. So please do your best to answer the questions that are present. It could take you anywhere from 5 minutes to 25 minutes, depending on the ailments that you list or agree that you have. So just make sure that you are prepared for that process at the end of your enrollment. If you don't have the answers to all the questions, do your very best to complete it. If there's any missing information, Symetra can always contact you if they have any questions.
And we also wanted to review the ACA. IQUBA's preferred PPO medical plan is equivalent to gold plans offered on the public marketplace exchanges. The $4,000, $8,000 deductible PPO plan is equivalent to silver plans offered out on the marketplace. IQUBA has lower out-of-pocket costs, broader networks of providers, pre-tax benefits. Your employer contributes to the HRA, and there are more generous free wellness benefits available to you. Your 1095 tax form is available in your employee file at IQUBAbenefits.org. Please keep this form for your records. It's not required this year, but you will need it if you're audited by the IRS. And then all other requirements of healthcare reform are in place at IQUBA. We did want to make note of the mobile apps that are available to you, and we wanted to highlight the new Blue Cross and Blue Shield My Health Toolkit app. You can, on that app, pull up a copy of your medical ID card, review your claims and benefits, check for in-network providers as well. This, along with all of the other mobile apps from our bank partners, are available to you and your covered dependents.
So we want to thank you for your attention. We hope you got some information, some good information from this webinar session. We are always available if you have questions at IQUBA, and your HR department is also available to answer any questions for you. Thank you.
Thank you.